All right, so we are doing Vet B. We've already done Vet A. That was the zones and the healthcare team, types of practices. Now we're on B, which one part was ethics, one part was the human-animal bond. And now we're doing safety, which I know we've already done that, but we're going to go into a little bit more detail, give you a little bit of vocabulary associated with it. And so my 4 lovely students have already been discussing some ideas of what could be scary safety-wise in the vet clinic, and they've come up with some good ideas. So I'm going to have them shout those out one at a time, and then we'll see if we can get any more. So, Ashley, I heard you talking about chemicals. What were you talking about for chemicals?
If you get like a chemical in your eye or on your skin, depending on what it is, it could really hurt you.
Good. All right. So where would you look to see how to treat that? Okay, you could look at the secondary label on the bottle. Excellent. Where else could you look for even more detail? What is that called? The right to know station. Good. What are those sheets of paper called that have everything you've ever wanted to know and more about every chemical? Yep.
Secondary sheets?
Secondary sheets?
Yeah.
Close. It starts with an S.
Safety sheets.
Safety data sheets. Good. Safety data sheets, or SDS. Good. Keyshawn, what was that word that starts with a Z that you were talking about?
Catching zoonotic diseases.
What does that mean? What is a zoonotic disease?
It could be transferred from animal to human.
Very good. So any of those zoonotic diseases, diseases that can be passed from an animal to a human. Can you guys give me some examples of zoonotic diseases? There's 4 of you. I'll have you each give me one. What's one? Rabies is one. Keyshawn?
Hookworm.
Hookworm is one. Ringworm is one.
Lepto?
And lepto is one. You got more? Go for it.
Roundworm.
Roundworm is one.
Mites.
Mites. Do you remember which mite? Is it Demodex or Sarcoptes?
Sarcoptes.
Very good. You guys are on it this morning. Sarcoptes. Do you have another one? Ringworm?
Yeah.
Yep. What's another?
Lives.
Lyme disease. What's the other tick-borne?
Rocky Mountains.
Rocky Mountain spotted fever. Good. How about the reptile and little chick? Salmonellosis. Good. Salmonella. How about the bird? Psittacosis. Have you guys been studying? Just say yes.
A little bit.
Good. Okay. It's fine. I think that might be it. Oh wait, pregnant lady.
Toxoplasmosis.
Good. Toxoplasmosis. Very good. Good job. All right. So now we have chemicals and we have zoonotic diseases. Keyshawn, what's the thing that a dog or a cat could do to you?
Bite you or scratch you.
Yeah, bites and scratches, right? That's probably self-explanatory. What else is scary? Yep.
Some of the tools we use,
The tools. What kind of tools?
like either like the scissors or like the knives we use.
Yeah, so scissors, right? Needles, scalpel blades. Not only could they cut you, but what do they have on them? It could be germs, it could be living organisms, right? Like bacteria. It could be carrying a zoonotic disease. Okay. What else?
Wearing proper PPE,
What's PPE?
personal protective equipment.
Good. Can you give me some examples?
Like if you were to X-ray using the lead, whenever we do chores we wear gloves.
Good.
Whenever we do fecal and urinalysis we wear glasses.
Very good. Good. So gloves and glasses if we're looking at samples and setting up samples. For doing x-rays, we have lead. We've got aprons and thyroid shields, and I'm going to show you another piece of equipment that we use. So why are we scared about radiation? Do you know what radiation causes? It can cause cancer, yeah. The more that you're exposed, the higher your chances are of cancer. All right. You were talking about some equipment. What's some scary equipment that we deal with, other than the x-ray machine? Yes, for surgical instruments, our autoclave gets really, really hot, right? It uses steam to kill every single living organism on that package, okay, on that pack. Good. What else is scary out there?
Centrifuges.
The centrifuge. What do they do?
They spin really fast, and if you don't have your hair tied back, you get it caught in it.
Yeah. Ugh, that would be so gross. So making sure it's come to a complete stop, having your hair tied back. Okay. You think of anything else? You guys had a great list. You guys are on it. I'm impressed. This is very, very good. Great participation. Love it. 10s all around so far. Yep.
What, like mixing what chemicals together?
Yeah, mixing chemicals, right? If you mix the wrong ones together, if you were a little bit hasty about it and it splashes in your eyes and you didn't have your PPE on, even storage, right? We talked about like heavy stuff on the bottom. Okay, great job, very good. All right, so we're gonna fill out our sheet that has the little blue bubbles on it. And you'll see for this, there's more writing than you need. I feel like I said that just the other day about zoonotic diseases. So I'm going to help you, okay? So each one has a big old heading, like a topic, and then we are going to just write some keywords down for each. So I'll help you. So this is what it looks like, your little bubble map. And on the side here is the topic that you can write down. So for one bubble, I don't care which bubble you choose, you're gonna write physical safety. And here you can write down, I would just say machines. So you already told me what machines you were scared of, the centrifuges.
Teachers, pardon this interruption. This is a reminder that we need you to survey your students to see how many breakfasts and lunches we will need for our virtual Wednesday. If you could please survey your students and get a count to Marissa as soon as possible, it would be greatly appreciated. Thank you very much.
Well, I got the count, I just didn't send it.
That scares me sometimes. Okay, yes. Someone just.
Okay. So machinery, how about slips and falls? How could we prevent that?
Red shoes.
Grippy shoes, yep. And what else could we use?
Clean up the mess.
Clean up your mess, that's exactly right. What do you see in restaurants all the time?
I don't know what they call those signs.
The signs, yeah. Keyshawn's like using his hand because it has the handles, right? And you can like move them around to what areas. Those big yellow bright signs. We don't have any, but I don't know, we probably should maybe. Lifting. You have some heavy creatures in here, right? Like Rocky, who won't get in the car for me, so I have to lift him. Do you lift like this with your back? Or this with your legs? You want to use your legs, right? You don't want to use your back. Usually the kind of rule of thumb is 50 pounds or more, you should get a partner. Okay, and here we are a little less than that because I don't want you to hurt yourself. But lifting with your legs, asking for help if you need it. Storage, there's Ashley's chemicals, okay? So heavy stuff should be lower. That way you're not reaching up here and maybe something spills on you, or it's awkward and it's hurting your neck as you get it down. So heavy stuff should be on the bottom. Anything that could spill in your eyes should be lower than eye level in case it tips over. How about eating and drinking? Where should you do that?
In the classroom.
Yeah, for here it'd be the classroom. It's the cleanest place. Right? Is it 100% clean? No. Luckily Wilson doesn't really get on the tables, so that's nice. But eating and drinking in a safe area. And then hot stuff, like the autoclave. Alright, just using those properly, being aware so that you don't burn yourself. Good with that bubble? See, I told you this was easy. Number 2, handling animals. This was Keyshawn's first idea. We want to avoid being bitten or scratched. So, not that we would want to be bit by anything, but if you had the choice between being bit by Rocky or being bit by a stray animal, which would you choose?
Rocky,
Why?
because he's vaccinated.
Yeah. He's vaccinated. We know his history, right? A stray animal, whatever it may be, could have any of those zoonotic diseases. All right. Surely, if they're living outside, they have fleas, right? We talked about cat scratch fever and cats. So, stray, wild, unvaccinated animals are the scariest. Another thing I have on there is dealing with safety. Don't let the clients restrain their pets. So a lot of clients are like, oh, so-and-so's better for me. I'll hold him for you. Like, he'll be fine. And then they get bit. Who is liable for that? Do you remember? Us. Yeah, the vet clinic. The vet is going to be held responsible for that. So they could be sued. It's a big, big no-no. Do a lot of vet clinics do that? Yes. Should they? No. Right? So if you have an animal that you need help with, a tech or an assistant should come in with you to help restrain that animal. All right. Now this is under the same thing, okay, the same bubble. Write down the word biohazard. Biohazard. What does bio mean? Life. Hazard just means dangerous, scary. So, scary living stuff is what biohazard means, okay? Biohazard is anything living. Blood, tissue, organs, any of that material, even debris like from a wound or from a nasty ear is considered biohazard. So you know when you go to the doctor and they have a trash can bin and then a red bin with a red bag and you're like, ooh, looks so scary, right? That's biohazard. Don't ever touch that because that's people yucky stuff that you can get things from, okay? So if you want to try to like maybe write this design here, that's the Notorious design. I picture the red bag and it's like 3 circles. That means there's biohazard material in there. So technically, even if you cleaned a dog's ears like we do in here, that material should go in the biohazard bag. Do we even have one of those in here? No. Okay. But the real common things that you would put in there at a vet clinic would be, excuse my words, but guts. Okay, so a uterus from a spay and the ovaries, you wouldn't want to put that in the normal trash can. So you would put that in we call it the gut bucket, and then you'd put it in a biohazard bag that a special company comes and removes from the clinic. Testicles from a castration. A tumor that you're not going to biopsy. Any of those things would go in the biohazard bag. Fetuses from a C-section for a cat that are not viable, you would put in the biohazard bag. Does that make sense? So red and these symbols are biohazard. You can get something from, wow, that was interesting. Okay. All right, another word I'd like you to put in that same bubble is just PPE, and I really don't think you guys need to write anything more down for that, unless you need to write personal protective equipment. You guys already had great examples. You said gloves and glasses for urine and stool, right? You have something that can splash into your eyes or be on your hands. If you remember birds that might have psittacosis, what were we going to wear? The mask. Why? Very good. The fecal dust could get in. How about, remember I sent you a picture of the crusty looking dog and you guys were like, ooh, you should wear gloves because you're handling the dog, and something, a gown, or wash your clothes, put on a different outfit afterwards. Luckily I knew his history. He's being treated. It wasn't Sarcoptes, which is kind of what it looked like. His owner doesn't have any symptoms and he literally sleeps right under her covers with her. So I knew it wasn't anything zoonotic, but I still had everyone wash their hands really good if they touched him, and wash your clothes when they get home. Okay, it's just always better to be safe. Some other PPE that we could talk about would be earplugs. And you're like, you can picture that for a construction site, right? Working with all that heavy equipment, the saws and things like that. But if you're working in, let's say, a boarding facility and the dogs are barking and barking and barking, you can actually have hearing damage, so you would maybe need to wear earplugs. Usually in a vet clinic setting, you're in and out of the kennel room so fast, even if they are loud as can be, you're not going to be in there for long. Ashley talked about our lead aprons and gowns, thyroid shields for radiation. And then we already talked about gloves, glasses, maybe even some masks. Okay? Alright, this is something that you don't even need to write down. But, do you guys know what a necropsy is? You do or don't? Do you know what an autopsy is? What's an autopsy?
It's like whenever somebody dies and you open them up to see what happened.
Yeah. So cause of death, you want to find out why they died, right? Sometimes you know how they died. Other times you're like, I'm not quite sure. So in people, it's called, yeah, you can use a hot glue gun if you want to try to fix it for me. Someone dropped it on accident. Yeah. An autopsy is the same exact thing as a necropsy, but autopsy is people, necropsy is animals. Why the different words? I don't really know. I've never looked it up. We're gonna do an activity with this at a later date. And no, I'm not bringing in a dead animal, don't worry. I'm not that awkward. Alright, finally bubble number 3. Oops, sorry. I wanna smile for the camera. Say hi, everyone. Is he in it?
Yeah.
Oh, what a good boy. What a fat cat. He's a fat, weird cat.
I got a question.
Yeah.
He has a little bit of white on him. Would you
Yeah.
consider a tuxedo?
Does he have it on his chest?
Yeah, a little bit. It's like a little small patch.
He probably could. But his bib definitely doesn't fit him if he was going to a royal ball.
Yeah.
He has one on his little fat pouch too, I noticed. And the inside of his ears. I think that's kind of cute. He used to be so handsome. Now he's just an old man. Luckily this one is changing, okay? I dreaded this. We used to dip animals. And so we're gonna watch a movie at some point called Temple Grandin. Have you guys ever watched Temple Grandin? You'll love it. It's about an autistic girl who became a vet, and she changed the way that you work with cattle for the better, okay? And for cows, they dip them in order to get parasites off of them, things like mites, okay? And so they literally just go under the water that has this medication in it and come back out. So we don't do the exact same thing for dogs or cats, but it's the same idea. We put them in the bathtub and we get this really horribly smelling, gives you a headache no matter how much ventilation you have to wear all of this gloves and gown and mask and glasses to kill mites on the dog or cat. And you're probably thinking, boy, if you have to cover yourself that much, how good is it for the animal? Well, that's a great question, That's part of why we're going away from it, is because it didn't work that great. It was not great for us to be doing it. So now they have developed medication a little bit better, that a lot of the topical preventatives that you give monthly actually treat mites. So this one is kind of going by the wayside, but I'm sure a lot of old school vets might still do this. So if you're going to dip them with those awful chemicals, you want to make sure that you have ventilation. So we had our bathtub in the kennel room. We would leave all the outside doors open, leave the kennel room door open, have the fan going, and you would still get a headache. Like, we would do nose goes. You know what nose goes means? Yeah, like whoever would touch your nose first didn't have to do it. So nobody liked doing this at all. It wasn't that common. We had a Dalmatian that would get it done all the time, and it never really helped her. And I wonder nowadays if we had treated her differently, now that we have better medicine, it would have been better. There actually is a little bit of argument on whether it can cause cancer in the animals and people. So there's another reason. Now, it's not hardcore documented that it causes that, but it's very possible. So look at this itchy, crusty, irritated skin. You know what kind of dog that is? Good, a Shar-Pei. Yep. All right, 4 is radiation. So our 4th bubble is radiation. If you want to write down the word cancer, okay, that's why we're so scared of radiation, is cancer. Now, you're not going to take one x-ray and get cancer. You guys have gotten x-rays before of your teeth, maybe a bone, right? And you didn't get cancer. It's if you keep doing it. So for you guys at your age, you'll be fine. You might have had it for your teeth, you might have had it for a bone. Me, I used to take 20 x-rays a day, minimum. That's a lot of radiation, okay? So in order for me to not get cancer, I would do a few things. First of all, I would never get in the pathway of the beam. So if you want to write avoid beam, and you're like, what is this, like a laser or something? We would have an x-ray machine, and up top here, there is, it's like a light that comes out so that we can focus where we want to take the x-ray. So if we had a big dog, our box might be this big. If we have a tiny little parakeet, it's going to be this big. I would never want to reach to where that light is, because that's where the radiation is going to come. Okay? So it goes through the animal and hits the cassette, just like taking a picture. You guys remember those Polaroid cameras? They're kind of like the new trend now. My boys have them and love them. Same concept there, except instead of a light source, we're using radiation. Okay? All right, so never get in that pathway. We're gonna wear our PPE. So gloves, gown, there's something called a thyroid shield, because your thyroid gland is right here in your neck, and the radiation loves that because it rapidly divides its cells. And so radiation loves cells that rapidly divide. That's where it usually gives you cancer. So we would wear a thyroid shield. Another thing we would wear is called a dosimetry badge. This is a picture of one. And this measures how much radiation you're exposed to. Which is kind of interesting. So I think it was every 3 months, pretty sure if I remember correctly, we would send these badges to the company that we got them from, and they would literally give us a report on this person was exposed to this much radiation, that person was exposed to that much radiation, because the radiation that bounces off the table, it's called scatter. You know when you pour water on a table and you see a little bit splashing up? It's the same effect there. So if I'm leaning over to take x-rays, I'm going to be exposed to more radiation. If I'm like this, maybe even behind a lead shield, I'm going to be exposed to even less radiation. So we would get those numbers back, and sometimes you would find people would have pretty high numbers, and so the supervisor would have to be like, what are you doing? Are you going too close to the beam? Are you not wearing your PPE? Maybe you're taking way too many x-rays, and they're gonna find out what's going on. Something's not right if your values are very high, okay? The chemicals that we use, this is kind of going by the wayside as well because we're going to digital now. All right, you know when you go to the dentist and they take the x-ray of your teeth and it pops right up on the screen? Didn't used to be that way, okay? When I was in the clinic, we would have to put it through a processing machine that would go and put the film through, like roll it through 3 different tanks, a fixer, a developer, and a wash. And those chemicals, it was enough to give you a headache too if you had to change them and clean it out. So those chemicals are very, very irritating even to your respiratory tract. So we would try to do that like outside and leave doors open, again, ventilation. But if your vet clinic has enough money, then they're going digital. It's much easier. How many bubbles do we have? We're not halfway yet, right?
Yeah,
2 more? 3 more? 3 more? Alright. This is kind of an interesting one. Have you ever had a surgery before? Have any of you had a surgery? You did? Did they put like a mask on your face and you like go to La La Land?
Yeah.
Yeah? This is what I'm talking about here then, okay? So, gas anesthesia is what you breathe in through a mask or through an endotracheal tube. Do you know where your trachea goes? It's either your stomach or your lungs. Your lungs, okay? We put a tube through your mouth and into your trachea, and we put this gas right into your lungs so that you're asleep and can't feel or move during the surgery. Okay? So if it's all closed like that, then you're great. There's no risk to you as an outsider. But if there is a leak in the machine, so this is the machine that takes the chemical and mixes it with oxygen and it goes through here and into the animal's lungs. If there's a leak anywhere, you start to smell, it kind of smells almost a little fruity, but like bitter. I can't really describe it, but once you smell anesthesia, you're like, ugh, it doesn't smell good, okay? That's when you should tell the technician or technologist, hey, I smell gas. And like not gas, right? Like not foofer, not tooting gas, like anesthetic gas, okay? And they go back to that machine and they try to figure out where the leak is. So why do we care about that? First of all, if it's bad enough, everyone in the clinic's gonna be sleeping on the floor. You're all gonna hit the ground. Now that would take a lot of gas, okay? But the other side of it is, if you are a female and you're pregnant, a lot of gas can actually lead to abortion. Okay, so your child would be stillborn. Or if you're not pregnant, then you can get a lot of liver and kidney damage. Okay, so again, this is like over time. It's not like you smell gas one day and you get this. It's if you're not careful, if you don't use it properly, if you don't say that you smell something. There's other things that you can do to avoid this, like trying to not mask animals down. We usually use injectable, so we poke them with an anesthetic, make them sleepy, and then intubate them and hook the machine up. That way, there's no way you can smell gas unless your machine has a defect in it. All right, so it's all about preventing us being around this gas, okay? Right here is something called soda lime or Sodazorb. These are little pellets and they're white. They kind of look like chalk. And when an animal breathes in from this tube the oxygen and the gas, then they exhale, right? They breathe out. You have to exhale, you have to breathe out, and that stays in the machine. If you inhale oxygen, what do you exhale? What do you breathe out? Do you know? Carbon dioxide, right? So that Sodasorb actually filters out the carbon dioxide. Otherwise, they suffocate and die from a buildup of CO2. So that's what this material is. But the reason I'm talking about it when we're not talking about our anesthesia unit, that's level 3, is if you handle that with your bare hands, it's actually very, 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 very irritating to your skin. Okay, even the dust, if you inhale it, it's not very good to breathe in. It's very, very irritating. All right, the vaporizer is this piece right here. The gas that makes you sleepy is actually a liquid. And so you unscrew the top and you pour this liquid in. If you are like pouring that in and you're like smelling it, that is exposing you to that anesthesia, and you're gonna have that liver, kidney damage, things like that. So when you're filling that, when you're refilling it, it just wants to be in a well-ventilated area. I used to always hold my breath. I mean, it smells terrible. It's so strong, it's like potent. So I would hold my breath, pour it in, close the top on real quick, okay? I know that's a lot of info for that one, but we'll learn more about that as a level 3, okay? Gases. Really the only gas that we deal with is oxygen, and it's for anesthesia 9 times out of 10. So these tanks are supposed to be in a dry, cool place. So if you're living in Florida and you're working at a vet clinic, you would want these inside in the air conditioning. You wouldn't want them outside in the humid temperature because they can actually explode. And we're not talking like, oh, a balloon popping. We're talking like your vet clinic will be no more. You want to keep them upright and secure because even if they fall onto the ground, they could explode. So you want to be careful when you're moving it around. There's so much pressure in it that if you open it and your eyeballs were exposed to it, it could actually blind you. So you want to wear glasses. So this is what's mixed with that chemical for anesthesia. Also, if you have, let's say, a dog or a cat come in and they're needing CPR, you can use oxygen. You can use oxygen for an oxygen tank for a dog or cat that's not breathing very well, just like humans. I think we have one more. All right, last one, number 7. Sharps. You guys thought of this too. Sharps. So not only could you have the trauma of being cut or poked, you're also looking at a really high chance of infection. The sharps that we deal with are needles and scalpel blades. Scalpel blades are used for surgeries to make incisions or cut things out. And this is another thing you've seen in your doctor's office is a sharps container, right? Could you imagine if you threw a needle in the trash and the cap wasn't on all the way and then the janitor goes to get the bag to throw in the trash can? It would not go over very well, right? So a sharps container is enclosed, really thick plastic. The lid really should never come off. and you just put those right into the container. What symbol do you see on that Sharps container? Why would that be a biohazard? It's just a needle.
Because the needle still could have gone into like an animal or a person.
Yeah, it
And
went
still have,
into something.
It still have like living tissue on it.
Yeah, living tissue, blood, piece of a uterus, whatever it might be, right? Is going to be in or on that sharp object. I think there's one more picture associated with this. Yep. All right, this is, you don't have to write it down, but this is how I have you guys put caps back onto your needles. When you get out into the clinic, you can do whatever you want, but when you're under my watch, if we're ever gonna use a needle, this is how you put it back on. So this is the needle right here, and that's the cap. They call it the race car method because you know when you hold like a Matchbox car when you're little and you're like, right? Spin it, okay. If you hold this syringe like that and then just scoop up the cap, there's no way that you can get poked. No way, okay? But if you hold the cap like this and you hold the syringe and needle like this and you're like shaky and nervous, then you accidentally poke your finger. Okay, or if you're in a rush, you accidentally poke your finger, okay? And then you might have not only blood in there, maybe you have a vaccine in there or a chemotherapeutic drug in there. And either of those things could make you very sick, okay? So this is the ideal method, but I will say once you get out into the real world, not a lot of people do it that way, which is not a good idea. Okay? You want to hear a gross story?
Sure.
Hold on 1 second. I gotta get a example for him. It's funny looking back. It wasn't funny when it happened.
Rocky. No. You know?
I don't think for them to open other water bottles. It's not fun, my dog does it.
Why can't you have the water? Some. Rocky, this, you know I have it. So I do what I want.
All right, well, I have bad news. I don't have the same exact thing. But when I was, I can't remember if I was in college or I was at the vet clinic, but syringes sometimes come in a case like this, like a sleeve. And then right here would be the cap of the needle, okay? So sometimes this is like really on there and it's hard to get it undone. And so a lot of people take it onto the table like this and they go bam, 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 and it loosens up this cap. And so I was going like that, bam, 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 and it came off on its own. Like, look, it's really hard to open. There, okay. So it came off on its own. So this came off, that piece. And then it was like this, right? And I didn't know it. So I was going down to bam it on the table again. And so then the cap came off with this and the needle was right here and it went through my hand. And I was like this and it was just like, it was awesome. It didn't hurt that bad. But word to the wise, don't go bam, bam, bam. Find another way to get it open. Make someone else open it. But luckily, it didn't even hurt me. It was uncomfortable, but lesson learned. No bam, bam, bam. All right? Okay, so let me show you this crossword that I'm talking about. I gave you a crossword and there's no answers on it, right? There's no definitions on it, and I did that for a reason, and that's because that's because I put it on Moodle, so I don't have to grade it. So you're going to use your blue Judah book to answer this, and some of this stuff we have not gone over. Okay, so if you read it and you're like, I have no idea what she's talking about, wait till tomorrow. Okay, so it's not due today, it'll be due tomorrow. But I just set it up as matching. So like refers to the use of x-rays. These are your choices. So you would just pick the answer.
Are you okay, Rocky?
Okay? Alright, so do tomorrow evening. Alright? And you can answer what you can today.